Comprehensive NCLEX RN Challenge Exam 11. Question 1. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysms? DM, HPN, PVD, syphilis. Hypertension, HPN, is the leading cause of abdominal aortic aneurysms as the constant high pressure weakens the arterial wall over time. Question 2. Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? Bruit, crackles, dullness, friction rubs. A systolic bruit is a vascular sound heard over an aneurysm caused by the turbulent flow of blood through the dilated area. Question 3. Which of the following groups of symptoms indicated a ruptured abdominal aneurysm? Lower back pain, increased BP, decreased RBC, increased WBC. Severe lower back pain, decreased BP, decreased RBC, increased WBC. Severe lower back pain, decreased BP, decreased RBC, decreased WBC. Intermittent lower back pain, decreased BP, decreased RBC, increased WBC. A rupture presents with sudden severe pain and signs of hemorrhagic shock, decreased BP, decreased RBC count, and an elevated WBC count due to stress. Question 4. Which of the following complications of an abdominal aortic repair is indicated by detection of a hematoma in the perineal area? Hernia, stage 1 pressure ulcer, retroperitoneal rupture at the repair site, rapid expansion of the aneurysm. A hematoma in the perineum or scrotum, or flank ecchymosis, suggests that blood is leaking into the retroperitoneal space from the surgical site. Question 5. Which hereditary disease is most closely linked to an aneurysm? Cystic fibrosis, lupus erythematosus, Marfan's syndrome, myocardial infarction. Marfan's syndrome is a connective tissue disorder that weakens the structural integrity of the aorta, significantly increasing the risk of aneurysms. Question 6. Which of the following treatments is the definitive one for a ruptured aneurysm? Antihypertensive medication administration, aortogram, beta-adrenergic blocker administration, surgical intervention. A ruptured aneurysm is a life-threatening emergency. Immediate surgical repair is the only definitive treatment to stop hemorrhage. Question 7. Which of the following heart muscle diseases is unrelated to other cardiovascular diseases? Cardiomyopathy, coronary artery disease, myocardial infarction, pericardial effusion. Cardiomyopathy is a primary disease of the heart muscle itself and is often not a result of other conditions like CAT or ME. Question 8. Which of the following types of cardiomyopathy can be associated with childbirth? Dilated, hypertrophic, myocarditis, restrictive. Peripartum cardiomyopathy is a form of dilated cardiomyopathy that occurs in late pregnancy or the first few months following delivery. Question 9. Septal involvement occurs in which type of cardiomyopathy? Congestive, dilated, hypertrophic, restrictive. Hypertrophic cardiomyopathy often involves asymmetric septal hypertrophy, which can lead to left ventricular outflow tract obstruction. Question 10. Which of the following recurring conditions commonly occurs in clients with cardiomyopathy? Heart failure, DM, ME, pericardial effusion. Structural changes in the heart muscle regardless of the type of cardiomyopathy eventually lead to the heart's inability to pump effectively, resulting in heart failure. Question 11. What is the term used to describe an enlargement of the heart muscle? Cardiomegaly, cardiomyopathy, myocarditis, pericarditis. Cardiomegaly literally translates to enlargement of the heart. Question 12. Dyspnea, cough, expectoration, weakness, and edema are classic signs and symptoms of which of the following conditions? Pericarditis, hypertension, obliterative, restrictive. Restrictive cardiomyopathy presents with symptoms of congestive heart failure due to the heart's inability to fill properly during diastole. Question 13. Which of the following types of cardiomyopathy does not affect cardiac output? Dilated, hypertrophic, restrictive, obliterative. In the early stages of hypertrophic cardiomyopathy, cardiac output is often maintained, though it may be compromised later if an obstruction develops. Question 14. Which of the following cardiac conditions does a fourth heart sound, S4, indicate? Dilated aorta, normally functioning heart, decreased myocardial contractility, failure of the ventricle to eject all blood. An S4 sound, atrial gallop, is produced when the atrium contracts against a stiff, non-compliant ventricle, often seen with decreased myocardial contractility. Question 15. Which of the following classes of drugs is widely used in the treatment of cardiomyopathy? Antihypertensive, beta-adrenergic blockers, calcium channel blockers, nitrates. Beta blockers are used to decrease heart rate and oxygen demand, allowing for better ventricular filling and reducing symptoms. Question 16. A 23-year-old client has substernal chest pain and a heart rate of 136. Breath sounds are clear. Which drug should the nurse question the client about using? Barbiturates, opioids, cocaine, benzodiazepines. Cocaine is a potent sympathomimetic that causes rapid tachycardia, vasoconstriction, and myocardial ischemia, leading to substernal chest pain. Question 17. Which assessment finding would strongly suggest that a painless breast lump is cancerous? Evershown of the right nipple and mobile mass, non-mobile mass with irregular edges, mobile mass that is soft and easily delineated, non-palpable right axillary lymph nodes. Malignant masses are typically hard, fixed to surrounding tissue, non-mobile, and have poorly defined or irregular borders. Question 18. A 35-year-old client with vaginal cancer asks about the usual treatment. Which treatment should the nurse name? Surgery, chemotherapy, radiation, immunotherapy. External beam or internal brachytherapy, radiation, is the most common primary treatment for vaginal cancer. Question 19. A biopsy report classifies a lesion as TIS, N0, M0. What does this classification mean? No evidence of primary tumor or metastasis, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastasis. Can't assess tumor or nodes. Carcinoma in situ with ascending degrees of distant metastasis. TIS stands for tumor in situ surface layer only, N0 means no lymph node involvement, and M0 means no distant metastasis. Question 20. When teaching a client how to care for a neck stoma after a laryngectomy, which instruction should be included? Keep the stoma uncovered. Keep the stoma dry. Family must perform all care. Keep the stoma moist. Maintaining moisture in the stoma is essential for wound healing and prevents the drying of secretions that can lead to airway obstruction. Question 21. Which type of cancer causes the most deaths in women? Breast cancer, lung cancer, brain cancer, colon and rectal cancer. While breast cancer is more common, lung cancer remains the leading cause of cancer-related mortality in women. Question 22. Antonio with lung cancer develops Horner's syndrome. When assessing for symptoms, the nurse should note miosis, partial eyelid ptosis, and anhidrosis on the affected side, chest pain, dyspnea, and cough, arm and shoulder pain with atrophy, hoarseness and dysphagia. Horner's syndrome is a triad of symptoms: drooping eyelid, ptosis, constricted pupil, miosis, and lack of sweating, anhidrosis, caused by nerve interference. Question 23. Vic asks the nurse what PSA is. The nurse should reply that it stands for prostate-specific antigen, which is used to screen for prostate cancer, protein serum antigen, pneumococcal strep antigen, Papanicula-specific antigen. PSA is a protein produced by the prostate gland. Elevated levels can indicate inflammation, benign enlargement, or prostate cancer. Question 24. What is the most important postoperative instruction after a subarachnoid block, spinal anesthesia? Avoid drinking liquids until the gag reflex returns. Avoid eating milk products for 24 hours. Notify a nurse if you experience blood in your urine. Remain supine for the time specified by the physician. Remaining supine, flat, prevents the loss of cerebrospinal fluid through the puncture site, which helps prevent a post-spinal headache. Question 25. A male client suspected of having colorectal cancer will require which diagnostic study to confirm the diagnosis? Stool hematist, carcinoembryonic antigen, SEA, sigmoidoscopy, abdominal computed tomography, CT, scan. Direct visualization via sigmoidoscopy or colonoscopy allows for a tissue biopsy, which is the only way to definitively confirm cancer. Question 26. Which finding most strongly suggests that a woman has breast cancer? Slight asymmetry of the breasts, a fixed nodular mass with dimpling of the overlying skin, bloody discharge from the nipple, multiple firm, round, freely movable masses. Skin dimpling, resembling an orange peel, and a fixed, immovable mass are characteristic indicators of invasive breast cancer. Question 27. A client with cancer is being evaluated for possible metastasis. Which of the following is one of the most common metastasis sites? Liver, colon, reproductive tract, white blood cells, WBCs. The liver is a primary site for metastasis for many cancers because of its large size and rich, double blood supply. Question 28. During an MRI scan to rule out a spinal cord lesion, which of the following would pose a threat to the client? The client lies still. The client asks questions. The client hears thumping sounds. The client wears a watch and wedding band. MRI uses a high-powered magnet. Metal objects like watches or wedding bands can be pulled toward the magnet or cause thermal burns. Question 29. Which of the following teaching points about preventing osteoporosis is correct? Obtain an X-ray every 3 years to detect loss. Avoid strenuous exercise. The RDA of calcium may be found in a wide variety of foods. RDA of calcium requires taking a supplement. Calcium is widely available in dairy, green leafy vegetables, and fortified foods. Dietary intake is the preferred method of prevention. Question 30. Before Jacob undergoes arthroscopy, which finding is a contraindication for this procedure? Joint pain, joint deformity, joint flexion of less than 50%, joint stiffness. Arthroscopy requires the joint to be maneuverable. If the client cannot flex the joint to at least 50%, the scope cannot be safely inserted.